Hello and thank you for joining me for another ITY video with top international executives. I have with me today David Bolton from Qlik. He is an expert in public sector data analysis. David, welcome to the program.
Thank you very much.
So I thought I'd just ask you to tell us briefly what Qlik does and what your role is at the company.
So Qlik as a platform is about bringing data together, usually organisational data within a business, turning that data into insight and information and putting it into the hands of business users to help them make better informed decisions right at the point of decision. So really about a platform that combines lots of data together in various formats and structures, lots of systems, and provides analytics at the point of decision.
Sure. And so what's your precise role there? Although, we can sort of guess data analysis, but give us a bit more detail.
So I work within our global industry solutions team, and our role really is to work with our teams in the regions to identify best practice within those industries. And in my case, that's healthcare and public sector and government. So we work with our customers and our prospects in those industries, helping them to identify where solutions can deliver real tangible value within their organisations, taking that best practice and sharing that with the broader organisations we work with.
Sure. Now, one of the sort of big newsworthy reasons why we're having a chat today is because you've developed an Ebola app. And that's not to give app users a case of Ebola, but to help, presumably, people fight against Ebola and track it. So, yeah, please tell us why you developed it and specifically what it does beyond my hypothetical musings.
Absolutely. So, working with our broader team, we developed the application because when Ebola first became obvious towards the sort of early part of last year, there was a real challenge with data collection. So data was being collected by multiple agencies in different regions, different countries.
And probably on different formats, on paper or electronically.
Yeah, and being able to combine all that together to give organisations trying to fight the spread of the disease a kind of global picture, if you like, was really, really challenging. There was some great work done in the US where some teams there were trying to pull this data together and give people that kind of overall look. But it failed to deliver the ability to really understand where to put resource, which direction was the disease spreading, where was mortality the highest, what impact was it having within those regions. What we tried to do was pull all that data together into a Qlik application and make it very easy for people to see where they needed to apply the right resource at the right time to prevent the disease spreading further.
And of course, with Ebola being such a virulent disease that with such catastrophic outcomes, I mean, such an app was clearly more important than ever.
Absolutely, and in that sense, the data being collected in a timely fashion and shared back into the application was critical.
So what other examples can you give about how, besides the obvious of what you just said, but how data impacts the effort to fight the spread of infectious disease?
Well, we're looking at a very different world now in terms of data and availability. So in many regions now, the wider population has access to mobile devices, and those devices collect data. And it could be data from social media, it could be people movements through the mobile networks themselves, but all of those things can help to identify where disease is prevalent.
We know about Google, sorry to interrupt, but we know about Google having being able to predict where flu is going to strike based on the amount of searches.
Algorithms.
Yeah, which is already an older story.
And during the Ebola crisis last year, there was a lot of work going on looking at people movements within the mobile networks. So where they knew somebody had been within an infected zone, they're able to track through their mobile phone the movements of those individuals and try and plan infection control and prevention to be in place in those areas. So it really did help to get a picture of the disease profile in those regions and help the agencies to understand where to put resources on the ground and how to prevent that spreading further.
So let's have a look at the app you created.
Okay, my pleasure.
Yep.
So I'm going to show you the app on the laptop here. This is available publicly on our website, so people can get a feel for what's out there and what can be seen. What we tried to do in the early days with this application was very simply show the spread of the disease over time.
Yep.
So you can see the charts on the left-hand side of the screen here showing the progress, both in terms of total cases, the people who died of the disease, unfortunately, and also the mortality rates within each of those regions. So clearly in a region where you have high levels of mortality, it's critical to get teams on the ground as early as possible to not only prevent mortality, but also to increase or decrease the chance of disease spreading further. So we also time series this so we can look across the different weeks and the points that the data was collected and see the number of cases as they ebb and flow within those regions. but also the mortality and the mortality rates. So we can see if we've put people on the ground in certain regions, what impact did that have on the spread and on the mortality? So you're getting instant feedback, certainly at the point of data collection, to try and understand progress as things happened. So these charts, for example, show a time series in a geographical format. So we can see that as time progressed, the disease spread further within this particular part of Western Africa, starting with almost no cases in these regions, gradually spreading and then increasing further over time. And this is a relatively short time period here. We're looking at the middle of December towards the end here, and July. So it's just a
6 months.
Yeah, very few short months, with the data listed underneath here as well. We can also see the total case profile against total deaths, so we can see where the gap is increasing, which obviously indicates an improved medical care, and the mortality rate reducing as well. And obviously with Qlik, at any point we can click and we can see what's happening within that period. So if I'm interested in the numbers for that particular period of time, it's very easy to make that selection and move that around and really understand what's going on at that point within the progress of the disease. So if I select that point, I can then move in and look at other aspects of disease control within that area. So as the data we were receiving was improving and collected, we're able with the application to get a much clearer picture as to what's going on. We also then kind of took a slightly different view, and as I said at the beginning of the interview, one of the real niche points of Qlik is our ability to take lots of data sets and connect them together. So we wanted to see the impact of the funding pledges that were being made by the various governments. So as we worked through this data, we loaded all of the funding that was being provided. We could then see where this funding was going to, so which countries, which regions, but also which aid organisations were receiving the funding. And that enabled us to then track back and see the impact of those projects and programmes, and also by country, who's pledging the most money, where is it being spent, and the impact of that on the ground. So we've tried to cover a much broader picture as to what really happened during that Ebola crisis, and the app really helped us to do that. In addition, we made the app available on a mobile format. So as you can see here, if I just show my iPad, we've got exactly the same thing with all the same capability and functions on the iPad. So if we're interested in just Guinea, for example, we can then drill into that and look at the regional data based on that selection.
Sure.
The iPad version can be accessed provided you're connected to the net. This can be accessed anywhere in the world, so it really helps the aid organisations on the ground to see the impact of the projects and the success they're having in fighting the disease.
Sure. And based on what you've just said, I mean, what are the other ways that healthcare providers are presently applying analytics? We've seen a few examples there. We can see they've got these apps, and more importantly, how do they need to think about its future use?
So we're working with more than 1,800 hospitals now around the world. So Qlik is being used across many different aspects of health, ranging from complex analytics, looking at readmission rates and length of stay, clinical variation, trying to understand the differences in care that are provided between different clinicians. We're used very heavily in the kind of finance area of health, so trying to understand how healthcare can be delivered more efficiently, but while still increasing clinical outcomes and improving patient experience within the healthcare system. So a typical healthcare provider is a very complex data animal. They'll have maybe 25, 30 different systems that are all recording information about patient care. It could also be around financial, around workforce, around supply chain information, supply chain being critical within health. And we work very closely with a large number of providers to try and combine all that information together and give them a holistic view of really the health of their organisation. How could they provide better quality of care more cheaply and still improve the outcomes from a patient point of view?
Yeah. So, I mean, some of those things would have been barriers in terms of they have to get over those things to be able to really take advantage of the technology and of the data. But what are the other barriers to healthcare and analytics adoption in your opinion?
So there's probably 2 or 3 key things here that have really been a challenge for the healthcare industry. One of those is the data, because the data is held in so many different places. Silos of data, disparate systems, real complexity in trying to get that kind of global view across the organisation. I think Qlik and tools like Qlik have really helped to deliver that kind of global picture. Historically, it's been very challenging. There's been a need for a lot of data wrangling in the background before information can become insight and be put into the hands of people that can really make behavioural changes at the point of decision. The other area is around usability. and the cultural impact of this type of information. So from a clinical point of view, their job is to save lives. It's to work with patients to improve the quality of care they're receiving. They aren't paid to look at dashboards and to do data analytics, but they can get great insight from analytics if the information's made available in a way that they can use and is accessible.
Yeah.
So I think one of the key things that Qlik has really achieved is clinical adoption. And that really is the difference between a successful IT program and an IT program that potentially flounders.
Yeah.
If people don't use it, doesn't matter how great the tools are, you won't see the business benefit and the value.
Sure. It needs to be indispensable.
Absolutely, and simplicity is the key.
So what are some of the best practices that healthcare organisations need to be aware of and adopt to get started on transforming their IT?
Right, so for me, I think early user adoption is critical. I think engaging with users, whether that's clinicians, managers, nursing staff, ward staff, it doesn't matter. Anyone who's going to have value from the information that's being provided, engage them early. Get them involved in the process, get them to support the development of the plan, what we're going to do, how we're going to show and present that information to deliver the most value to the business. So that's really key, and I think early engagement in adoption is one of the primary factors that really does have an impact. I think providing a system or a solution which can really deliver something that isn't currently available is also key. So a lot of this data is available in siloed reports. They get Excel spreadsheets, they get PDF reports. They're often a month or even a quarter out of date. The decisions are being made on very old information, and health works at the speed of people.
Well, and with Qlik, I mean, the data that's being fed into it can be fed real time, so they can be getting real time information.
Absolutely right. So a lot of the success we've had in health has been around what I would probably call near real time.
I mean, the speed of people can be the speed of now if the people are empowered with tools to help them to input that information, update it and use it. It doesn't have to be the speed of people from a month ago or a quarter ago.
Absolutely right, and I think that's a critical point. So if you look at some of the challenges that most regions have faced with emergency medicine, if you go to an emergency room, you expect to be treated and cared for as quickly and efficiently as possible.
Even though it seems to take hours before they can.
Absolutely. So a number of regions, the UK, Australia included, have put in place a 4-hour rule now where patients should be in, triaged, treated and released, or admitted depending on the severity of the condition. And one of the challenges of meeting that goal is, well, how do we really understand where the bottlenecks are? If we've got patients flowing through the department at different times of day, it's 24/7 operation. How do we try and uncover the bottlenecks and understand if we apply more resource in these areas, what impact is that going to have on the performance of our ED? And Qlik is helping hundreds of hospitals in that specific area. We're turning the paradigm of analytics from looking in the rear view mirror, trying to look at data from a month ago, from a week ago, to looking at data in the here and now. We're taking patient flow as they come into department, understanding the impact that might have in 4 hours. Are we going to breach that rule? Are we going to provide optimal care? And we're processing and alerting on that basis. So we're physically, proactively providing data to people in real time off the back of patient flow within a hospital. It's having a transformative impact in health.
Or what other transformation can we expect to see? I mean, that's one aspect of it.
Yeah.
I mean, in a perfect world, you'd turn up, you'd be treated in minutes, you'd be given the magic pill, and off you go. But we don't live in the perfect world. So how else, will healthcare be transformed?
So I think if I take another customer example to give you a real world example. We've worked very closely now with the Sydney Local Health District here in Australia, and those guys have deployed Qlik over a period of years into the majority of their departments in the organisation. One of the areas they found very early on was their ability to use Qlik to uncover additional revenue. So obviously, financial.
I mean, that normally doesn't happen with these sort of tools.
No, a lot of them focus on the clinical side.
Yep.
But we've used Qlik in Sydney Local Health District to really uncover where additional revenue can be found from the existing services they provide. So they built an application in a few weeks which looked at where they're missing revenue from private patients. That application, in a 7-month period, delivered $2.5 million of additional revenue to the hospital.
Amazing.
You can imagine the impact that can have on patient care. It's phenomenal. Additional resource, capabilities centres in just 7 months.
And cutting wastage.
Cutting huge amounts of wastage, So
and in public health systems, that's nothing could be more important.
Absolutely right, yeah. And the bottom line is it has to be about patient outcomes.
Yeah.
Data is a fantastic way of uncovering insight that delivers improved patient outcomes.
So I always like at this point in the interview to just change gears a little bit and find out, you know, I always like to ask about the best piece of advice you've ever received to help you get to where you are today. It's always inspired by Ashton Kutcher, who asked this question when he came to Australia with a Lenovo event, and I thought I'll ask everybody that, so I always do. So
okay, mine would be very simple.
Yeah,
I think probably
the simple things in life are often the
yeah,
best. So you know,
I think probably the best advice I ever had was listen more than you talk.
well,
Simple as that.
they say 2 ears and one mouth.
2 ears and 1 mouth,
Yeah.
and it's certainly set me in good stead. I think you know, you can learn every single day if you're open to learning, and to me that's critical in this role.
Yeah, and sometimes I need to listen more, but, but I think we all do.
Fair.
So, do you have any final comments for IT Wire viewers and readers, and for your current and potential customers?
No, I think we've covered a great deal around the healthcare side. I think, you know, Qlik as a platform is growing strength to strength in this industry. I haven't really touched on my other side of the role, which is around government, public sector, but we're working with hundreds of government organisations too, in areas such as policing, defence, security, right through to education, and trying to understand how we can improve the state of education within regions and countries. So it's an exciting time for us as a company. I think the platform approach, the ability to go, you know, the real kind of end-to-end analytics capability in Qlik is fantastic, and I'm delighted to be part of it.
You're humanising big data.
Absolutely.
All right, thank you very much.
Thank you.